Hi everyone, my name is Caitlin, and I'm here to talk today about why Colorado and this country needs universal health care. But really, I'm here to tell you a story, my story. I started getting migraines when I was 13, and if you're not aware, migraines are not just bad headaches. They're a complex neurological disorder, and the head pain is just one part of it. For me, they were so severe I couldn't get out of bed, couldn't look at my phone screen, couldn't even call for help. I would vomit from the pain. I missed birthdays, holidays, and so many chances to just live my life because I physically couldn't show up. And for years, I was told that my migraines weren't that serious. I even had a doctor say, well, if they're not sending you to the ER, how bad could they really be? It took over a decade for my pain to be taken seriously. By the time I got to a headache specialist, I had already lost years of my life to pain. But getting the right doctor wasn't the end of the fight. It was just the start of a new one with my insurance company. They make medications these days that are specifically to treat migraine headaches, but my insurance wouldn't let me try them until I first proved that 3 different classes of older off-label drugs didn't work. These were originally designed for conditions like seizures, not migraines, and they came with side effects like slurred speech, hair thinning, weight gain, and intense fatigue. I tried them all. None of them helped my pain. Finally, after months of jumping through hoops, my insurance allowed me to try the newer migraine medications. They changed my life. I went from fearing I'd have to leave the workforce and going on disability to feeling like I had a fighting chance again. My migraines didn't disappear, but they became manageable, and that was everything. But even now, years later, every time I need to get a refill or another round of medication, I have to fight my insurance for it. Another prior authorization, another round of playing their games and saying the right words that they want to hear. I have to prove again and again that I deserve the treatment my doctor already prescribed. And even when it's approved, I've had to pay hundreds out of pocket because insurance wouldn't cover the full cost. Sometimes the meds were only affordable because the drug companies stepped in with their copay insurance assistance programs. And that left me wondering, what exactly is my insurance even doing? It's confusing and exhausting, and I'm constantly waiting for the other shoe to drop, wondering if the cost will spike again, or if I'll be denied the care I depend on. And every time I change jobs or insurance plans, I live with the fear that I'll be forced to start all over again, that I'll have to go back to the drugs that didn't work just to satisfy a bureaucracy that doesn't know me and doesn't care. The truth is, I'm lucky. I've had good jobs and understanding bosses, but not everyone does, especially those who suffer with chronic pain like I do. Our system ties healthcare to employment, and that's not just unfair, it's cruel. No one should lose access to care because they got sick. No one should have to stay in a job that hurts them just to keep their medications. Living with chronic pain is hard enough. You shouldn't have to fight an insurance company on top of it. You shouldn't have to prove your suffering to people who've never felt it. Healthcare should be a right, not a reward for working full time, not a perk for those who can afford it. We all deserve care, healthy or sick. Employed or not, we deserve a system that listens to our doctors, respects our pain, and treats us with dignity. Universal health care is how we get there. It's how we put people before profit and care before capitalism. It's not a partisan issue, it's a human one. Thank you. Yeah.